Hi friends, my name is Dr. Unnikrishnan and I am working in the SUT Pattam Hospital, and our chair is B.R. Shetty Saab, and my role here is perform the job of vascular surgeon, which I have been practicing for the last 35 years at Sri Chitra Institute. And as probably would have heard about, vascular surgery pertains to the diseases or afflictions involving the pure blood vessels or the impure blood vessels supplying the parts, such important parts of the body like brain, legs, arms, kidneys and intestine. And also I do some thoracic operations as well. As you might already know, as we live longer, as subjects, we are going to have lifestyle diseases, which means it is related to maybe our overeating, obesity, diminished or lack of exercises, and also as we collect diabetes and hypertension, and of course some habits like smoking and alcohol. All this put together, as we grow older to something like 60-65 years, lifestyle diseases can occur, which means people can develop, subjects can develop symptoms of stroke. That means difficulty in speaking or paralysis, or the aorta or arteries, pure blood vessels, they go on bulging, which can burst and produce even danger to life, danger to organ. So today I'll tell you a little more about prevention of stroke. 65 years or elderly who have diabetes or hypertension, they are more prone for this, and what they have is fat collection at the beginning of the artery supplying brain, and they have sometimes a little difficulty in speaking or little difficulty in moving the leg or arm, or something like a stroke which will last only a few minutes. They may recover immediately, but then when they have such difficulties, especially in an elderly patient or a subject, they should consult a doctor, identify the cause and prevent major stroke, which is disabling, and sometimes even it can threaten life. So I have in my life so far, we have done 291 such operations, which almost last 100 patients recovering normally. Even at SUT Pattam, I have performed 7 procedures and all of them have recovered well. So it's always important to do some screening tests, by which I mean anybody above 65-70 who have diabetes and hypertension. Simple examination of blood as well as duplex scan to define or delineate the blood vessel which supplies to the brain, called the carotid arteries, can be imaged, and preventive measures can be taken so that a catastrophic stroke and thereby the difficulty for the patient, for the family and society can be avoided. Also, I do surgery for open as well as mini surgery for minimally invasive surgery for aortic aneurysm, thoracic as well as abdominal. Revascularize legs so that subjects can walk, and otherwise the limb can be threatened, limb can maybe have to be removed. So we can prevent by doing vascular surgery, and that's my role in SUT Pattam, which I am happy to belong to. Thank you.